Okay, hello everyone, and welcome to another Insights from Women Leaders event. My name is Rola Kaakeh, and I'm the CEO of Salus Vitae Group, and I'll be the host for the event. For those joining us again, welcome back. And then for those new to the series, welcome. We're so happy to have you join us today and be a part of this conversation. Now, a little background on the Insights from Women Leaders series. We launched the series in October to highlight the journeys and contributions of various women leaders in healthcare. These industry leaders will share their insights on a range of topics impacting healthcare, our communities, and their role in shaping the future. We've had several guest leaders so far, all providing valuable insights and perspectives. I encourage everyone to check out the recordings of our previous guest leaders if you haven't already done so. They're all available on our website. Now, over the course of an hour, we ask our guest leaders a number of questions. I start with the first set of questions, and then we actually open it up to the audience questions. So please submit any questions you may have in the Q&A box. We encourage you both during and after the event to post any takeaways from the event in the Q&A box and on various social media platforms, and you're welcome to tag us at Salus Vitae Group. We love hearing how you benefited from the various insights and experiences of our distinguished leaders. Now, the session will be recorded and available for replay after the event. Now, let's get started. I'm pleased to introduce and welcome our guest leader today, Dr. Fatima Stanford. Dr. Stanford practices and teaches at Massachusetts General Hospital and Harvard Medical School as one of the first fellowship-trained obesity medicine physicians in the world. Dr. Stanford received her BS and MPH from Emory University as an MLK Scholar and her MD from the Medical College of Georgia School of Medicine as a Stoney Scholar, and her MPA from Harvard Kennedy School of Government as a Zuckerman Fellow in the Harvard Center for Public Leadership. She completed her Obesity Medicine and Nutrition Fellowship at Mass General Hospital and Harvard Medical School after completing her internal medicine and pediatrics residency at the University of South Carolina. She has served as a health communications fellow at the Centers for Disease Control and Prevention and as a behavioral sciences intern at the American Cancer Society. Upon completion of her MPH, she received the Gold Congressional Award, the highest honor that Congress bestows upon America's youth. Dr. Stanford has completed a medicine and media internship at the Discovery Channel. An American Medical Association Foundation Leadership Award recipient in 2005, she also received AMA's, or the American Medical Association, Paul Ambrose Award for National Leadership among Resident Physicians in 2009. And then she was also selected for the AMA Inspirational Physician Award in 2015. The American College of Physicians, or ACP, selected her as the 2013 recipient of the Joseph E. Johnson Leadership Award, and the Massachusetts ACP selected her for the Young Leadership Award in 2015. She is the 2017 recipient of the HMS Amos Diversity Award and Massachusetts Medical Society Award for Women's Health. In 2019, she was selected as the Suffolk District Community Clinician of the Year and for the Reducing Health Disparities Award for MMS. She was selected for the Obesity Society Clinician of the Year in 2020. As you can see, she's a recognized leader, and we're so lucky to have her with us today to talk about leadership. So welcome, and thank you so much for taking the time to be with us today, Dr. Stanford.
Thanks for having me. It's a delight to be here.
Okay, so we're gonna just jump right into the questions.
Excellent.
As we have done in the previous sessions. So the first question that we ask across the board for all our guest leaders, as we go from their background, their extensive background and various experiences, to where they are today. So did you expect to be where you are today?
Well, I did expect to be a physician. Actually, I have a very funny story that I like to tell about, kind of my early life. When I was 4, my parents had to come in to meet with my teacher because she asked, well, Fatima, what would you like to be when you grow up? And I was like, I would like to be a doctor, a lawyer, and an actress. And she was like, well, you have to pick one. And I was like, but I don't want to pick one. I want to be all 3. And it's interesting, obviously, I'm not an attorney or an actress, but if we look at the different roles that I hold as a physician, as a media personality, as an activist, as a researcher, as a teacher and educator. I really had, multiple jobs in mind. So if I think about what I was thinking at 4 and what I think about in my 40s, there's some similarities between what I saw myself doing then and what I see myself doing now. So I wouldn't say it, completely predicted it correctly, or maybe an attorney and actress is in my future. I don't know, but I would say that I did see, medicine as being a huge part of who I was at a very early stage of life.
I get it. So you probably definitely saw early on that it wasn't just going to be one thing.
It was not going to be one thing. It's still not going to be one thing ever. So
that's awesome. I really like that. It's like a mindset, regardless of when you were young and now. So you definitely didn't want just one thing to define you.
No, not at all.
That's awesome. So our next set of questions looks at the future. So we just briefly mentioned about your past, but now looking into the future, what excites you about the future? What are you really looking forward to? You're going to be that actress or lawyer?
No, what I'm very interested in is just seeing, how what I do in medicine, what I do in leadership will really impact others around me. So if I think about my work in obesity, the largest chronic disease, which impacts us here in the United States and around the world, I'm hoping to change the narrative of how patients seek care, how physicians, how pharmacists like yourself, how all other healthcare professionals are educated about the disease, because right now we're really failing individuals that struggle in this way. And so my goal is to help change that narrative with regards to that primary work. As a leader in issues surrounding racism, diversity, equity, and inclusion, recognizing that persons like myself who have the number of degrees and awards that you were able to rattle off experience these same issues regardless of what our stature is, what our status is, and showing that we have to think about the entire continuum of individuals across all socioeconomic strata, all gender, however you define yourself. I think it's really important because we don't recognize often, especially as persons climb the socioeconomic ladder or the academic ladder or the leadership ladder, that what persons are experiencing at those high levels were quite treacherous to get to that point. So, thinking about how I can do the work to really serve in a way to make it better for those that are coming behind me, as I'm thinking about persons that are Black women, for example. How do I set an example for them to kind of come behind and also hopefully pave the path for those that are coming behind them. So not just setting it up for the individual that sees, hey, I've made it through this door, but what are they going to do to make it better? Because there's a lot of work that needs to be done, particularly here in the United States, surrounding issues of inequities for Black women, but for all underrepresented groups. But I would say Black women particularly have, some of the toughest and obstacles that I would say that we face. Thinking about the future also, I'm open and receptive to opportunities of what will be. Will I be a U.S. Senator? I don't know. Will I be someone who spends a lot of my time in the media as a predominant area of focus? I'm not sure, but I'm open and receptive to whatever opportunities feel right for me. Trusting my gut, my intuition, using my faith to guide my judgment with regards to these things is really going to be paramount. And I've learned this over my life, that I really have to trust these opportunities. Sometimes they come and you're like, oh, I would have never thought about these things. And then deciding if it feels like the right fit. Sometimes you immediately feel like something is not the right fit. And so I will make sure that I also listen to that voice. And then with my variety of interests, I would say the key thing is making sure that I prioritize what's of the most significant importance at that given time, recognizing that changes and melds over time. As opportunities change, as I change, as I grow, to make sure that I'm, picking what feels right for the moment.
So you made a wonderful point. You talked about the narrative of the specific topics or causes and changing that narrative. And then, of course, we also have a narrative about us as individuals in terms of when we talk about a legacy, a very specific, if we have a specific legacy, or is it very broad? Do you find yourself thinking a lot about a specific legacy that you personally want to leave behind? Or is your narrative embedded within these other narratives that you just mentioned?
You know, that's a tough question. I think that, you know, when I look at the narrative piece of the puzzle, I probably look at it both ways, right? Like I think of my narrative as really paving the path, being a trailblazer, being embedded into the work that I do, right? That's who I am as an individual. It's who I was when I was 3. It's who I am now in my 40s. It's who I will be, you know, for however old or however long I live. When I go into different paths, I tend to be a person that's a trailblazer in that space. It's where I feel comfortable leading the initiative, driving the direction, creating energy and enthusiasm behind something that may not have been focused on very much in the past. When we look at obesity, for example, as a disease, it was only 2013 that the American Medical Association decided to acknowledge obesity as a disease. I was a fellow at the time when they flew me in to have that talk with the House of Delegates before that pivotal vote. That was a new space. People were kind of like, what are you, obesity doctor? I don't understand what that means. Or do you deliver babies and OB? And I'm like, no, it's, you know, kind of creating a new space, but forging path. And often with, I guess, taking up the banner for those that are disenfranchised. I mean, if we think about obesity, that group has been disenfranchised, faced a lot of weight bias and stigma. If we look at persons that are from African descent, like myself, a significant stigma, bias issues. Those are the issues I tend to tackle. And whether I choose to or not, I think it's just what I've been put here to do is to take on the big issues of our time. And those are two of the more prominent issues. And making and hopefully changing how people see these, how people see the people that live through these things, and making, you know, kind of creating a different focal point, a different viewpoint, opening up one's brain to the perspectives that may be different from the ones that they may have encountered. And so, you know, if I look at that, right, the trailblazer, the person that creates this new space, the person that goes out and creates a new dynamic within the space, that's who I am as an individual, but also within the work. So that's why I'm going to say that it's a little bit of both.
That's great. So actually that takes us to the next question in terms of tools we need. So you mentioned a lot about being the trailblazer, going and addressing these enormous challenges, but to address these challenges and these issues, there's several tools at hand and some stuff that you've learned over the years in terms of what's worked. What tools do we need to take to help either be that trailblazer or help guide the way to positive impact? What are some tools there?
So first of all, I think you have to believe in yourself, right? If you don't believe in yourself, you're not going to be able to motivate or energize or promote in any way, because people don't see you as strong enough to be able to take up that charge. So believing in yourself, your own abilities, your own I guess strength, I think, is key. You know, a lot of times, you know, when we look at ourselves, we are our own worst critics, right? We are the ones that know all about ourselves, right? Because we live, eat, and breathe ourselves. And so we try to find those things that we see as negative things that may hinder us. I would say kind of put aside that voice. It's not that you don't want to be aware of things that may be weaknesses that may need strengthened. But if you're going to be a leader and go and lead a group of people, people want to be behind someone they see as strong, someone they see as willing to carry kind of the burden. And so that means you have to believe in that yourself, I would say, number one. Number two, you know, as you're looking at challenges, recognize you can't do it alone, right? I can't do any of what I've stated with regards to obesity, with regards to racism. That's not something I can shoulder by myself. I have to have key allies. I have to have key enthusiasts. As I look at some of the attendees today, I see one person that really stands out in this way. This is who I call my Boston mother. Her name's Elizabeth Guckenheimer. She probably doesn't know I'm going to call her out because I don't usually, but what I really appreciate about her as an individual, let's just say, is she has seen my desires, my abilities, and has wanted to work to help elevate and strengthen and sponsor me in ways that I've not seen, you know, throughout my life. And it just brings me such gratification to have someone that is there, that's willing to help you. You can't, no matter how strong you are, we can't do this alone. I kind of see my hero as Harriet Tubman, someone who was able to guide people regardless of what, terror she faced it, through the Underground Railroad to freedom, and then do it again, and then again, and then again. But she couldn't do it alone. She had to have different people along the path to help her. Her goal was to get as many people across the finish line, but she needed allies. So knowing that you need allies, you need a group of people that can help support, elevate, I think is extremely important. And then when I come to number 3, recognize that you're going to need different skill sets. So for someone who's done, I'm working on my 5th degree now, so I have my bachelor's of science, my MD, my MPH, my MPA, I'm working on my MBA. That's a lot of different skill sets for one person, but even if not just within myself, recognizing that different skill sets, different frames of reference and different frames of thought are going to only yield the best possible outcome. So having those as part of really the conversation, working together, looking at different sectors, recognizing that each has their individual thing to bring that only enhances the work. I think that's probably the next or the final thing I would say with regards to this.
I love, so the 3, as you were talking, I literally just grouped them into those 3 things. The first one, when you did focus on yourself in terms of building tools, it was really focused on the self-esteem, the, building yourself within the strength, really, right, to be able to address that first. And the second, really to ask for help and create that group of people that will support you. And then the third one about skills is so great because it's a constant, you have to constantly grow and learn all of those new skills. So I really like how you address those, because oftentimes when we think about tools, we start thinking of these checklists of items that we need to learn first. But I think that order is so wonderful because you build a base and foundation moving forward. So how do you define success as you begin to look at your own career or even in any initiatives that you're working on?
I define success as my ability to create a better space for those coming behind me. I think, probably in my earlier years, it was like, how many awards can I garner? What can I do? Like, how fast can I do it? That was definitely the kind of the high school Fatima, if you have to go back to that. And as I've gotten older, as I've gotten wiser, as I've had more experiences, I realize I get significant gratification for getting others to certain spaces. My ability to mentor and to encourage, I think, is superior to many, and this isn't a competition, but it's because I can immediately speak with someone and see where their strengths are, how I can help them be their best self. And so that I define success, really not just by my success, but I would say that my success comes from the success of others. And that's whether it's the people I mentor or for my patients. I think about my patients and the work I do with them. I sometimes tell them, I was like, I think I'm more excited than you are. They're like, no, I'm excited. They just may express it differently. But I get significant gratification by looking at what they're doing. For example, last week I saw a patient who happens to be in academics, and she has reached levels in terms of her resolution of disease, her weight response to therapy, higher than any I've seen in my career, which says a lot because I have some really great response. That stands out to me. It's not my per se accomplishment. It was something we did together. I was telling my patient, I'm the coach, they're the star player, but I need them to show up. How her body responded, mind-blowing to me, which for me to be blown away, absolutely amazing. But it shows that if you stand behind someone, if I tell my patients that you can do this, I'm here to support you be your best self. We'll see what that looks like. We're going to try different things. Well, I don't know what the answer is. Your body will give me the answers. So here again, it comes back to me getting so much gratification about their success. Then of course that leads me to be successful, right? You can say I'm the clinician of the year because I did this, but it's really me working in partnership. If you really listen to this constant theme, me working as part of that team. Yes, maybe leading the team, but still being part of the team and not just being an individual that's out here over here doing my own thing without recognizing that it's not just me, it's the interworkings of the team that make it really successful. So success for me is the success of others that I've happened to impact through either my mentorship or through my work with them in their treatment of their chronic disease, whatever it is, that's where I get, that's what I feel is the definition of success in my eyes.
That's wonderful. So we've talked a lot about different initiatives that you're working on, different degrees that you're working on, what you've been able to accomplish. But for you, how much of your time do you spend in execution phase versus the planning phase?
Thankfully, my brain moves very fast. So I would say I plan very quickly. So for let's say there's a manuscript, right? I'm an academic person. So a manuscript that I have to submit to a journal, my brain can put together pretty quickly, okay, with any of these 5 people, this is what we're going to have to do. You know, this is where we're going to submit. This is the 5 journals. Like I can do that kind of, you know, rapidly. You know, I guess, you know, you're going to spend much more time on the execution, right? Like, so how do now we pull this together? How do we make this a deliverable, a presentable product? I'm one of those people that believes in products, you know, like what the product is, and this is the product of the academic work, the success metric, or things of that sort, and putting together the right team, realizing that sometimes they're going to be persons in the team that may not be the best in the group. And so there are these situations where you have to reassess, right? I can usually do that pretty quickly because I recognize that usually in, like, let's say a group of 5, there's the one person that may be throwing off the balance of the group. And so then I may need to make a pivot. So recognizing that piece of the puzzle, I think, is also super important. But yeah, so I think that I spend less time in planning, more time in execution. That's just how because my brain plans very fast. Like, okay, I can already think, you know, for the next 6 months, okay, this is what we're supposed to do. But then now you have to actually do the work, right? So the execution is what takes the longer part. But, you know, keeping people to timelines and guidelines, I don't like, I get very wary of submitting things on the deadline date or whatever time. I like to have it done like a month in advance if I can, because inevitably something will come up. Maybe there's something with patients or something with a deadline that I didn't anticipate that just comes at you out of the blue. And if you are getting it on just the day, those things become more stressors, right, to you. But if you had it in a month ahead, and let's say that month now ended up only being 2 weeks ahead, you feel really comfortable. You're not stressed about those things. And so that tends to be how I like to operate. Now, most humans don't like to operate that way. Most humans are like, okay, the deadline is 5 p.m. today. We're going to work to get it in at 4:58. That doesn't work well with me. I like to have this nice cushion just because inevitably things will come up, you know, like, for example, we couldn't have predicted COVID-19, right? Like that was something that came up. We had to pivot very quickly, right? That's a huge thing. You know, usually smaller things that come up in your life that you're like, okay, well, I need to change this direction, or I need to go this direction, do this, shuffle this here and move that there. And my brain can usually do that rearranging. It'd be nice, you know, to kind of see, like, you know, projected on the wall, like how my brain
like
works.
What's happening?
Yeah. Like, but yeah, that's how I tend to think about it.
So that's a great actually transition to our next question related to the pandemic and the current situation that we're in. Like you mentioned, so many of us have had to pivot and do things differently or introduce new initiatives as a result of the pandemic. What new initiatives have emerged in your space during the pandemic, or maybe as a result of the pandemic?
So I would say the nation's reckoning with race has been a major shift in terms of what I spend my time doing and talking about. I've always, as a Black woman, unfortunately dealt with racism in my life, but it wasn't until recently that people began to pay attention to it in a way that I think is unprecedented since the civil rights era in the 1960s, which predates me. So a lot of my work and time has focused on presenting about racism, serving and anti-racism initiatives, directing programs surrounding this issue. I have done quite a bit of this work in the past, but the intensity and the volume has increased tremendously during the pandemic. We had COVID-19 kind of, you know, take off in March, and then, you know, really only a few months later, we saw this issue with George Floyd, Ahmaud Arbery, Breonna Taylor, et cetera, take precedence, and organizations that had not traditionally decided to address racism began to, at least on the surface, say they wanted to address it. So who do they come to? They come to someone like me that has a track record in the space. And so a lot of my work has kind of fallen under this realm, and I am thankful that people will listen to my voice, but I would be more thankful to see that change happens and that change is sustainable, so that the stressors, the barriers that I've had to face, like I said, in my lifetime, don't affect those behind me as prominently, or not at all, if I could really have my say in the matter. So I would say that that's taken up a lot of my time, and has taken up a lot more space, and a deviation from the status quo pre-pandemic.
I mean, even to add to what you're saying in terms of the pandemic, the COVID-19 also has disproportionately affected people of color and those within like the lower socioeconomic status. I know here in Chicago, we see that very clearly within the data. So that is brought to light in terms of thinking about new initiatives. How do we talk about it? How do we change the narrative? What do we need to do? And then we're also talking about that now with the vaccine, in preparation for the vaccine, right? Who gets it first? How do we prioritize? So that's definitely, it's always been a very important topic. But I think right now, as we design the better systems, we have to design with equity in mind. And so looking at those types of populations are very important moving forward. So
absolutely. I think it's entrenched in, and talking, like one of the presentations I recently gave was on the color of COVID, looking at particularly groups that are Black, Latinx, Indigenous persons here in the United States, and the disproportionate impact on both morbidity and mortality for these populations. But this isn't anything new. It's risen to a level of importance because of just how many people are dying from COVID-19. And it's quite, challenging to navigate personally when I think about the people that have been lost, that I know personally, but also obviously as a doctor, right? Like seeing this happen, seeing how it affects everything that we do in healthcare, and how it affects everything in life, right? We've seen a major shift in life. I mean, like right now, for example, we're at the highest levels of food insecurity since over almost 100 years. And so as we're going into seasons that are highly focused around foods and things of that, we're not just talking about, are they going to have foods for Thanksgiving holidays? We're talking about, how are they going to have foods to make it through tomorrow? And so I'm, as someone that really, like I said, talks about and thinks about equity, these things have risen. I'm thinking about, how can I address them? I'm thinking about the intersectionality of race and poverty, and structural and systemic racism. These things are overlapping, and they've always been there. We saw this play out in issues like Hurricane Katrina, but that was confined to the New Orleans area. This is nationwide, and so we're seeing this play out on the national stage.
So now we're going to transition into the topic of leadership and mentorship. So we asked a question to our leaders, and we asked you, what top 2 skills do you believe a great leader must have to be successful? You responded with the following: I believe a leader should be knowledgeable and compassionate. A leader's knowledge provides a compass for progress, while their compassion will allow them to understand team dynamics to reach a common goal. Can you elaborate on this, and what has really shaped this outlook for you?
Okay, well, so a lot to say there. So knowledge, I think that, the blind can't lead the blind. In this situation, I'm not talking about someone that's physically, like has vision loss. But if you don't know a particular topic or area, it's really hard to lead in that area. So knowledge is key. I spend my life consistently gathering knowledge to support my expertise in certain areas. I believe that as humans, we should be constantly learning, constantly seeking how to enhance, to not rest on our laurels. And so knowledge, I think, is really the key thing that makes a leader, right? Or I should say a leader, an expert, let's say an expert. It's then that compassion of knowing how to work within the team dynamics that then makes you the good leader, okay? So you can put together a team, but let's say someone in the team is experiencing a tragic loss in their family. For me to expect the same out of someone that may have recently lost a spouse or a parent or whatever it may be, the same thing out of that person for someone else that has not experienced that would be, really short-sighted. I would not show the compassion that's necessary for them to be enhanced and lifted up in their time of significant need. So I need to have a high EQ. I think we pay a lot of attention to IQ, and I think if I have one of those, that's great. But the EQ part, that emotional quotient, our ability to understand relationships, understand dynamics of people, to pick that up quickly and make sure that we're supporting those that may need more support than others, okay? There are people that I'm working with and I know that in 5 seconds they're gonna have something done. Of course, I'm exaggerating a bit. And there are others that I need to help give support. They may need several building blocks to get them to that same level, or maybe they don't get to that same level. I don't go and compare and contrast them. I recognize their strengths. I recognize who needs to be in what role within the team and help strengthen where they are. You know, everyone is going to have different strengths. I have different strengths than you and vice versa. And it doesn't mean that one is better or worse. It just means that I need to recognize that, have that compassion, use the knowledge to promote and elevate the team. And here again, going back to that team dynamic, it's about understanding the dynamics of the team, understanding the emotions of the team, understanding that affects the work, the product of the team. So yes, that's what I would say. There was a second question you asked. I can't remember what the second question was.
How, and what shaped this outlook through years?
No, I would say that, you know, my upbringing really shaped this outlook. I give a lot of credence to my maternal grandmother, who I lost many years ago. She recognized very early that I was this leader, this person that liked to lead people. And she spent a lot of time instilling education. The reason why I skipped first grade, for example, she was a first grade teacher. So she taught me kindergarten, or between kindergarten and first grade, she taught me all of first grade. So I got to first grade and I knew everything. So I would just sit there and finish everything in 2 minutes and sit in the corner. And the teachers recognized this and met with my parents. I felt like my parents had to have a lot of parent-teacher meetings, but met with my parents and we're like, you know, I think she seems to know everything. So let's send her to second grade. So they sent me to second grade a week later and I got there and I knew a lot of that stuff. And so they called my parents back in again and they were like, I think she knows second grade. And they were like, oh, wait a minute, hold up. We want her to be emotionally, you know, mature when she gets older. So halted me at that point. I think that was actually a really good, you know, thing for my parents to do, to just make sure that I was on par and not too far off developmentally, particularly in adolescent years from my peers. But, you know, my grandmother said, you know, really allowed me to see that I could do and be anything that I wanted to be. It was just a matter of gathering the knowledge, right? She was a school teacher, gather the knowledge, and then use your, you know, kind of natural bornness skill set to be a leader. I can't really teach when I'm thinking about teaching my medical students or my residents and fellows. I can teach them obesity, for example, but I can't teach them how to treat patients a way that they feel respected, uplifted. That comes from within them. They can kind of try to model me, but people can tell when something's forced or when it's genuine, especially in times where they feel at the lowest of their low. And when I'm dealing with my patients that have obesity, and often many who have severe, they're coming to you at a very vulnerable portion in their life, and they're having to deal with something that they often have struggled with throughout their lives, and being told that it was all their fault. So how do I get people to change? You know, I don't know with regards to that. That compassion is not easy to learn. The knowledge, yes, I can teach the knowledge. They can learn the books. They can answer the questions correct. But are you able to sense what that patient needs at that moment? Are you able to adjust maybe what your plan was to make sure that you're doing the best service to them? And so I would say it comes from my maternal grandmother. It comes from my family, but I'm going to give my maternal grandmother, you know, really major points here for guiding me in that way.
So that actually I was thinking of a question as you were talking about in terms of the knowledge and intelligence, like a subject matter expert, and versus that kind of emotional intelligent aspect. But when you're looking for a mentor or a leader, or kind of creating this group of people for your environment so that you're successful, do you find yourself always going after, not like going after, but like pursuing or wanting someone that has both? Or do you say like, I want, you know, I have this mentor for the technical aspect, this one for the emotional? I mean, how do you then begin to think, or do you surround yourself with people that are both, like that have both of those elements, or?
I would say kind of for me, it at least kind of organically comes. I don't really go seeking after mentors. I don't think I really ever have. And I don't go seeking after those that I mentor. They kind of just show up. It's just organic. And I don't know if that's just because I interact in so many environments that there's just an overabundance, I think, of people in either direction. When I look at the people that I see as sponsors or mentors, I think that they have different skill sets. Some are very compassionate, some are very knowledgeable, some happen to have both. But I don't necessarily go looking for those traits and or qualities. Some people just may be a subject matter expert. They know this piece of things very, very well, and I need that knowledge base. And so I don't expect to get much more from them. That's not going to be someone I share, some vulnerability I have. That wouldn't be the right person. That would be someone else that has that high EQ that I can immediately pick up. I would say for individuals to surround yourself with a mixture, a potpourri of individuals that have different strengths, recognizing that no one person is going to be all of that for you. None of us are all of that for a team, right? Like we are part of a group typically, even in entrepreneurship, if you think about it as someone who's also an entrepreneur. I think about the work that I do, but I think about kind of the pieces I have to have in place to make me do the work that I do, and my work and speaking engagements and things of that sort. So, no one just has it all. I'm not, for example, even as I'm doing my MBA now, I hate accounting. I absolutely hate it. I don't understand any of it doesn't make any sense to me, even after taking numerous courses. That means that I need to be working with someone that has that expertise. Even as an entrepreneur, that's not something I need to handle on my own. Recognizing that that's something that's not one of my strengths is okay. It's okay to not be strong at every single thing. But as soon as you recognize, ooh, that's a place that I need some assistance, getting that assistance. And similarly, when you're thinking about mentorship, also recognizing that. I do want to say one key word that always bothers me in mentorship is when, let's say, someone that's very senior approaches you and they're like, oh, I would love for you to mentor this person. And they didn't reach out on their own to do that. That feels, very uncomfortable to me, because I think the person has to have that own initiative. Hey, Dr. Stanford, I would really love to meet with you. This is why. Here's my CV or whatever it is that they're handing over. This is what I'm hoping to get from this relationship. When the other person is doing all of the work, whether it's the parent or the senior person, usually when you end up meeting with this individual, whomever they are, the enthusiasm is low, the synergy is low. I'm already not happy about the meeting to start with because it doesn't feel that it's self-directed, that self-motivation. And so that's just my own pet peeve. I believe that, if it's something that you want from me, reach out to me. If I don't respond, that's one thing, but if I respond to you and it's something that you feel is a synergy that we create and we both decide that there's a synergy that continues, then that's great. But someone else trying to do that for you doesn't work too well for me. I believe in that independent thought, that independent initiative. And when you don't have that doesn't jive well with me. And it may for others, but for me, as someone that's been very independent, who's been really geared towards creating my own path, those are things that I really respect in individuals. And then if you don't have those, probably not the best fit in terms of working with me.
Those are really great. Actually, that'll transition us to the next question about advice and leadership lessons that you can provide to current and future healthcare leaders at different stages of their career. One you just mentioned now in terms of being proactive and demonstrating that you take the initiative on and that you're interested and that you're excited about any opportunity, whether it be a mentorship relationship or across the board. But what other advice would you provide? Our audience is very diverse.
So, I mean, like I said, I think number one, initiative, whatever it is, if you're going after being an attorney or if you want to be a business person or whatever your career path may be or whatever your passion may be, maybe it's a hobby that you really want to, you have to take that initiative. You have to decide in your mind, this is what I want to do. This is how I'm going to pursue it, and pursue it fervently. I think that when we can immediately pick up like I said, if you're, that's not you, then it doesn't resonate well with me as someone who's had to drive myself, who hasn't really just had everything handed to me. I've had to really push for every ounce of everything that I've gotten. And so those are traits that I really see and is excited about. I think about some of my mentees and the ones that really kind of just do this. I mean, I try to help shape them in areas where I see some deficits, but that initiative piece is really, really key. With regards to leadership, I think that, just constantly, doing a self-check. Which things are you doing well? Which things are you not doing so well at any given time? Because what often happens in leaders is that we get so consumed in our work that we miss other key things of our life, whether it's our personal life that we've neglected because we've spent so much time in our work, whether it's our anything else, we may divert. Maybe our faith is a huge part of us, and we've not made that a major part. Maybe exercise. I mean, just naming key things. And so maybe you have to be intentional about just every aspect of your life. Like, how much are you spending towards each of these periods of things? Is there any deficit? How do you then get back to a space of equilibrium? And I think that's a constant thing, because each day is different. Each time of our lives are different in terms of where our mind and attention is diverted. How do we bring ourselves back into equilibrium? I think that's something that's extremely important.
Okay, so I would recommend for the audience, if you have questions, to submit them to the Q&A box. We just have one final question, and then we're going to open it up to the audience. So the last question, and we ask this to all guest leaders, as we would like to take this opportunity to support one another and recognize the positive influence we have on one another. Name a woman who's inspired you, and why did you choose this person?
I mean, I'm gonna have to go Harriet Tubman. Obviously I've never met her, but I've known about her my whole life. I just see her tenacity and her drive despite all odds, someone that was going to fight regardless of the obstacles that were put in front of her. And I mean, do it with such strength and dignity. I can't think of anyone else that really, speaks to me really quite in that way. She was, a trailblazer. She was blazing a new path, making it better for those that came behind her without necessarily the need for recognition or reward. Her goal was just, how can I make it better for these people? This is what I experienced. These are the challenge I did. Willing to have that independent spirit to make it happen against all odds. So I would say, going back to Harriet, not someone I've met, someone I feel like I know, someone who I feel lives within me. That's really someone that I really kind of espouse and really look up to in terms of her abilities, her dedication, and her ability to persevere despite all odds.
Well, thank you for that. Now we're going to open it to the questions from the audience. We have one regarding the role of social media and different platforms. So what do you think about the role of social media for female leaders to inspire young females to lead through different platforms?
So, I use social media quite a bit. I find that I thrive most, I think there's all these different platforms, and it's kind of hard to decide where you're going to spend your space. I would say I thrive more on the LinkedIn platform, because I think just because I'm professional and very highly academic, and so that tends to lend itself best to the LinkedIn platform. But how I found about this was through the LinkedIn platform. This is how this connection happened. And so I find a lot of my professional endeavors really can come through that platform. So I would say that I would say that of all of the platforms, I think LinkedIn is the most professional, the one that really kind of sets who you are as a leader, kind of can define some of those key elements. You can present it in one concise, it's not like this rapid chatter of things that you have to kind of sort through. So I think LinkedIn is, if I were picking one for most people that are leaders, that's where people are looking to. If you're a leader in business or law or architecture or medicine, whatever, they're all there. That's one kind of common platform where you can look for leaders without getting the chatter from other things. I would say, if you're looking at something like Instagram is all about focus. So me pausing for the picture, not a lot of content per se. I guess you can do videos and things of that sort. I would say it requires a lot more energy, a lot of time. If you have someone that can do that for you, great. I don't have someone that can do that for me. So I find that I'm a bit more sparse on that platform. Twitter, I think is where you go to kind of, show your personality. What are you angry about? What gets you passionate? What gets you worked up? For each of these, obviously you're going to, if you just pick one, that's probably a good idea, because then you don't have to get into the hustle and bustle of everything. But then people will say, well, what about that one or this one? So you feel like you at least should have some presence, whether it's more minimal and certain platforms. And usually people will have one that kind of is their shining star. For me, I told you that is LinkedIn. I do have a presence on Twitter also. I'm not one of those people that sits there all day. I'm work 80 to 100 hours. So sometimes they'll be like, I sent you a message on Twitter. I'll check it like 3 days later. If I'm doing something live, it's a little bit very ADD, ADHD for the Twitter platform. It's just kind of constantly moving. You never know where people are. So I think there's different personality types for each of these. But I think as a leader, I think you definitely have to have a LinkedIn platform. That's really, it shows without, like I said, all of the chatter, all of the background noise. So that's my thoughts on social media. I do think you can use it. I think you can leverage it. And you want to present the best and most polished person, that you are. I mean, obviously you want to show the differences and the facets of who you are. And that can come through the different platforms. But I think that the most polished platform is the LinkedIn platform.
Okay, so the next question states, how can physicians build their emotional quotients to improve communication with patients? So
this is a hard one, because I think that a lot of it is learned, right? I think that, we have to start teaching children when they're born how to have this great EQ, so that when they become physicians, because by the time they go to med school, they're already well into their adult life. And by the time they're finished with residency, they're into midlife almost, that you really have to start very early. I think you can potentially expose, future physicians to conversations like this for them to hear, oh gosh, I do well in school. I get great grades, but I have noticed patients feel uncomfortable, but they have to be in tune to know to think that way. It's not just about how hotbed. You have to think medicine. When you're applying to medical school, everybody cares about what your test scores are or how well you did in your science classes. They don't care about how you treat people. I think that should be a change on the side of the medical school admissions, thing. How do we pick that up? But then how do you pick the people to interview to pick that up? So some of the people that are in high ranks in medical schools or hospitals aren't necessarily people that have high EQs. They're people that just did well on tests or happen to know the right person to get into that role. And so medicine has to change as a whole to really, best treat patients. We have to begin to recognize that the interaction with patients is just as meaningful as the knowledge base we have regarding whatever the disease process is.
And because when you start making recommendations, it's much more likely that they follow the recommendations that you make and work with you more efficiently if they feel like they can trust you and they have a relationship with you, for sure.
Absolutely.
The next question gets at staying positive throughout all of this. We talked a lot, there's different themes throughout this talk so far about having that growth mindset, being intentional, being ambitious, knowing what skills you have and what you need to build, and being part of the narrative of these various topics that are very big. But how do you stay positive? And right now, given, everybody I think is feeling the weight of everything. So are there strategies that you use? Is there a specific mindset? Telling people just to have a positive mindset is not the same as taking these steps towards having that.
Yeah, I think this varies so much from person to person, right? Everyone kind of approaches life in a different way. I always tell patients, it's finding what works for them. So for me, my faith as a Christian is extremely important guiding force. When I feel negativity creeping in, I'm able to pull up the scripture or whatever it might be that, has been really the foundation of who I am as an individual, and push through a situation. Because if I am not optimal or not positive, how am I going to be that for my patients? How am I going to be that for the people I mentor? Is every day a challenge? Absolutely. Are some days more challenging than others? Absolutely. Today is starting off as a good day. We'll see what it's like when I finish with all the things I have to do late this evening. And, there may be, roadblocks that are thrown into your day, something that just really upsets you as you're going along. But I can't remain in that space for a long time and be effective. I just really can't. If people need me, if I stay in that space, and if I think about maybe being needed, a lot of people kind of, feel a different drive when they feel needed by individuals than just relying on kind of their own internal drive. And so when I feel needed by all of these different people from all over the place, I feel like I have to show up. I have to be in the right mindset. I have to recognize that I have to, whatever it's hurt, whatever pain, whatever, I have to push through that, because I can't be for them who I need to be if I'm not where I need to be. I would say that's the way I think about it, and finding whatever it is, whether it's your faith, whether you're someone that's about, likes to meditate, whether it's, your physical activity. I think physical activity is a huge part of me being not a mean person. At baseline, I'm really serious. I, am very driven, very goal-directed, very goal-oriented. That exercise piece of the puzzle also helps to just kind of, when I'm doing my exercise, I'm not one of those people that's on my phone or doing all these other things at the same time. I try to drive my attention to just that moment, just doing that work, unless I'm on call for the hospital, and that's a different story for a different day. It also messed up my bicycle ride on Saturday, but I was like, we're literally just getting on my bicycle ride and got paged. That's one thing. But when I'm not in that setting where I'm on call for the hospital or whatever it might be, putting yourself in that space and being 100% present in whatever it is you're doing, whether it's your exercise, whether it's your faith base, whether it's, your meditation space, whatever it is, being 100% present for that time. Now, however long or however short it is, I think helps.
I agree. I like looking at it also from how you bring this up in terms of when others need you, and that gives you the motivation and the drive. Goes back to how when you initially define success and kind of your impact on others. And I think then you didn't give you're not throwing the whole burden just on yourself in terms of my success. What do I need to do? And then when you feel burned out, it's very easy because it's just centered on you. Right. Whereas you've kind of you've dispersed it, which actually motivates you then to go beyond that, which is really nice. And I think this is a topic too, as we've noticed, especially in healthcare, so many healthcare workers get burned out and tired. And so as we kind of think about creating strategies to help our colleagues or those within this space in terms of thinking about all the challenges and how we can help them, right? The other dynamic of, being not only seeking those that can help you, but can you be that person for someone else?
Exactly. And sometimes that's exactly, I think about, usually the people you need to check on in your life are the strongest people. Those are the people that are carrying a lot of burdens. And so people say, oh, well, they don't need any assistance. They're so strong, they're handling it, but they're carrying, the loads of, let's say, hundreds or thousands or millions of people. Those are the people that do need you, because no one's checking on them. They're checking on everyone else, but no one's checking on them. So I would say for those people that you see, oh, well, they're so strong, they're so this, check on them. There are often a lot of things going on with them that you are unaware, but they're just able to show up, promote or project that positive attitude. And so you don't see what's going on for them, because as humans, we all have things going on at all times. And for them, whoever those people are, they often have burdens that are significantly higher than what others would experience just because of their degree to unfortunately handle these bigger burdens. So check on them, check on your strong friends, I think is the key to thinking about this.
So we only have a few more minutes. Are there any other closing remarks or final thoughts you'd like to add?
I think as you're thinking about your own leadership style, think about what is you. Everyone has a different approach to the world, a different approach to living, a different approach to thought, a different approach to leadership. It doesn't mean that one is right or one is wrong. Maybe there was some snippet of what I said today that can complement what you're doing, or you're like, you know what, that's just not me. That's not how I feel in leadership. And that's okay. It doesn't mean that one thing is right or wrong. It just means finding the best fit for you in your leadership style and promoting those around you. And if that's a key part, and maybe recognizing that if you weren't promoting those around you, that might bring you a bit more joy and gratification than hyper-focusing on just you as an individual. There's a saying that I always say that, is a driving force for me in terms of how I think about it. And I'm gonna say it how it's stated, and then I'm gonna modify it. So Dr. Benjamin Elijah Mays, who was the educator for Dr. Martin Luther King, but also the namesake for my high school in Atlanta, Georgia, has a saying that I like to think about in terms of what I do. And that is strive to do something so well that no person living, no person dead, and no person yet to be born could do it any better. So that focuses on the individual, focuses on the me, right? Who I am. But I would say strive to do something so well that no person living, your group, no group that's dead, or no group that's yet to be born could do any better, so that you then promote the whole team, not just the individual, which is how we hyper-focus here in the US, right? It's all about individual success. My thing is, how do I get others to succeed? So while that's still a guiding principle for who I am and the work that I do, it's really me thinking about that in terms of the team dynamics. How do I drive people to be their best, happiest, healthiest self? That's how I would conclude.
That's awesome. Well, that's a wonderful conclusion. So on behalf of Salus Vitae Group and myself, I would like to thank Dr. Stanford for joining us today and for sharing her experiences and outlooks. We had a wonderful conversation about leadership and all these various elements. So be sure to take some notes throughout all of this. There are several actionable items and recommendations to take home. Now, we have several exceptional leaders in the coming weeks as we approach the end of 2020. So please visit our website, salusvitaegroup.com, to learn more and register for the upcoming events. Again, we would love to hear about any takeaways that you have from this session. So we encourage you to post about them, share your thoughts, and then tag us at Salus Vitae Group. So thank you all for attending, and we hope to see you at our next event. Thank you.